And Human Rights Now is founded in 2006 and based in international human rights organization based in Tokyo. And also that this symposium and co-sponsored by the PSL and Physicians for Social Responsibility and Peace Board US and also Human Rights Now. And so we today, and I will a little bit talk about, we need to protect women's and children's health in Fukushima. And what happened now? You know that today is March 13th. This means that the third years started, and from the event happened. And so these are many things happens. So I will talk a little bit deeply later. And so then first, I will say that. And so many things happen. So the opposite to the promoting the health. And these events, getting the situation worse. And the first, I want to say that the declining numbers of evacuees outside of Fukushima. This means that many people come back to Fukushima. And this means that even the Fukushima is, the almost all areas of the Fukushima is highly contaminated. But the Fukushima prefectures and local government, also the cities and the villages, want to, the people come back. And this kind of situation happen now. And also the most problem is relaxing the evacuation zone. I will talk this later. And the number of the deaths after the disaster happens. And also I will show the slide later. And the people died. Maybe someone is committed suicide, and also that someone the die because this time the tsunami or the nuclear radiation. There's no the immediate death of the radiation, but that many people have to evacuate from the house and the community, and this means that some stories then happen to them, and so then that they have to they boring that they have to they have no chance to go to the clinics or hospital, and because the evacuee have to leave the new community, and it's very difficult to find a good doctor, and also these kind of things happen. So then the high percentage of the deaths happen after the disaster. And also the slow and insufficient compensation by TEPCO, and also the consolation payment by TEPCO. And it's if someone live in the evacuation zone, and that $100 US and per person per year is paid by TEPCO, but it is, of course, it's not enough and money for the people who evacuate from the community. And also the nuclear workers, those not appropriately recorded. So I will talk a little bit later. And also the cleanup, and there's many cleanup activities happen. But the cleanup activities, we are wondering how much effective are the cleanup activities, and also that I will talk a little bit about later. And the cleanup scandals happen, and also that Fukushima's victim support law was enacted, but no concrete measures taken. Okay. And also the decreasing number of the evacuees outside of Fukushima. Last month, the government officials announced that only the 57 1,000 evacuees outside of Fukushima. So total Fukushima's evacuees the 154,000. It's only the 1/3 is outside of Fukushima. These reasons why the economical reason and also the increasing stress and the usually is if the family living in Fukushima and so there's many voluntary evacuees in Fukushima and. In the case of the voluntary evacuee, they have a husband and wife and the children, and the husband have to stay in Fukushima because he has a job in Fukushima. And so only the mother and the children go doing the evacuation outside of Fukushima, and also that there's many the money issues happen. Also that there's many psychological issues happen, and also that this kind of the relaxation evacuation zone and left one is the first evacuation zone setting by the government. And the first one is 20 kilometers from the accident that Fukushima Daiichi nuclear power plants. And also there's a changes rapid and slowly, and also the right one is new evacuation zone, and it's very clear. You could see the red zone is the minimizing. And so red zone, the first red zone, the 20 kilometers radius and evacuation zone, yellow zone planned evacuation zone, and hotspot inside of Fukushima, some places is very hot spot, and also that government said that it is recommended evacuation points. And points mean that not the area, it's only the household, and also this means that if this house is say that it's recommended evacuation points, but the next house is not. This is only the point is not the area. And also the plus we changed our government changed the policy. Red zone over the 50 microsievert per year. The government said that the difficult to return zone, and also that the orange zone and 20 to 50 microsievert per year is a restricted zone, and gray zone under 20 microsievert per year. The preparation of evacuation order release zone. This means the gray zone and even the gray zone and the very high radiation level, but then the government tried to change the policy. The red zone is minimizing. And also the many support to promote return. New compensation policy, if introduced, if someone decided to go back to green zone. So this means that if someone wants to go back to the green zone area, and even that this area is very high, the radiation dose, some money goes to somebody who want to go back to the green zone. And also the second one is a very problematic things. And new residential support plan for evacuees from outside of Fukushima is this mainly focus on the pregnant women and the children. And if the pregnant women or children decided to go back to Fukushima, and Fukushima prefecture will offer the new very good houses and without payment. And this kind of policy introduced, this means that the government, local government want to come back, want the people back to their area. And so this is a very not good situation for the women's and children's health. And also that this is a chart, the numbers of deaths after this disaster. And also that the first the bar is Fukushima. And the second one, Miyagi in Iwate. This is three disasters area. And it's very easy to know that the Fukushima's death is a very high number of the Fukushima deaths, the high number of the deaths that happen in Fukushima. And so Fukushima evacuees, almost all Fukushima evacuees affected by the nuclear power, the accident. And some newspapers say that this is a nuclear power plant accidents related deaths. And also there's no immediate deaths happen, but even now the new the deaths is happening relating to the nuclear power plant accidents. And also I will talk a little bit about the cleanup scandals. Some cleanup crews did not follow the protocols. This means that there are many the strict protocols happen to the cleanup, but some cleanup crews dumping the radiation tainted waste into the rivers and elsewhere in Fukushima. This is not as good as a more contaminated area is spreaded. And also the human rights took the many actions and fact-finding mission in these cities. These cities, the not the evacuation zone is, but there's many hot spots, and also that in the case of Fukushima City and Koreama City is a very high radiation, and those is happen even now. And also we did some report, and unfortunately only the second one you could read in English. And we tried to translate it, the whole report, but we need some time. And also that we also requested, I sent a letter to request country visit to Japan, UN Special Rapporteurs, that 2011. And it's happened last year. It takes 1 year. The rapporteur come because Japanese government didn't accept the first offer from the United Nations. But and also we issues many statements and connecting to the Fukushima's issues. And so very fortunate, and we could get the special rapporteur as the right of everyone to the enjoyment of the highest attainable standards of the physical and the mental health. Mr. Arnold Grover visited Japan during the 15th to 16th November last year. He published a press conference, and his final report will be expected the next June. To the UN Human Rights the committee. And this is he did a press conference at the last day of his visit. He mentioned the many concerns about Fukushima. And the first one, the radiation safety standards. And the radiation safety standards, as you know, the 20 millisievert per year is too high. This standard is violated is 1970 into industrial safety regulation, and in Japan, also it is significantly inferior to the measurements taken after the Chernobyl accident, 5 millisievert per year, and disregarded epidemiological studies. And also that he concerned about the Fukushima's health management survey. The Fukushima's health management survey is done like this, and questionnaires and thyroid the examination for children, and also only the people who live in Fukushima prefecture, and the thyroid examination is available only to those who are under 18 years old once every year. And no blood and urine and exposed examination, and no rights to access to the medical record. Only the outcome say that yeah, you are okay or not. It's only the information the children and the parents could get. And he recommended that monitor the impact of the radiation on the people's and the health and the radiation affected zone through the holistic and comprehensive screening and provide appropriate treatment, and also others. And he said that this is not enough. It's a very small, and he said. And also the radiation monitoring system is, he concerned about the radiation monitoring system. The collecting accurate radiation dose data is essential, but the hotspot in Fukushima ignored. And then the measurement result of the monitoring stations established by the ministry are neither accurately nor comprehensively representing the contamination and situation in a neighborhood area. He said the radiation monitoring stations do not reflect the varied dosage levels in area in the close proximity. And also he concerned another issue, the right to life and in the safe and healthy environment. And he did 2 recommendations. And to adopt action plan with clear timelines and indicator and the benchmarks for the decontamination to reduce radiation level to the 5 microsievert and residential area, and also the others, and you can see that. And nuclear plants workers and also the nuclear power, nobody knows how many workers and the working in that area. I mean, the TEPCO and ask the work in the power plant, but maybe there's many layers, and also that it means that nobody knows who worked in the power plant after the accident happened. And also the other concern happens, and also the Fukushima's victim support law must be implemented, and also that the affected people must be involved the process of the decision making. These are lacking in Japanese situation. And his concerns, of course, are our concern. And drastic policy changes are needed. And so we are thinking the children's women's first policy must be introduced. Now we are taking our government taking the children and women's last policy. And so then we need more support and solidarity to make this change happen. And thank you.